My name is Colin Reyes, and I'm gonna go ahead and call this meeting to order at 11:40. And we're gonna go ahead and do roll call.
Marina with Max Purpose.
Pero me dijo volver a la audiencia si quieren.
Jesse Hernandez, la Public Counsel first.
Era como tu mayor.
Viviana Martinez, Leeds Recovery Center.
Lindsay Vasquez, Ruby Overly.
Jessica Gonzalez, Redwood Recovery. Abigail Martinez, OCBCI. Papa Jimenez, OCBC, Brooks Recovery.
Tuve Botello, Alma Concilios Valley.
Ana Pérez Rivera, Piero.
Iselda Fabrias Scam. Adriana Morales, Public Health Department.
Eric Logan, Ray Public Health.
Richard Chamberlain, Loretta Public Health.
Linda Llanos, Deputy Attorney, Given Locals.
Catalina Novello, Fire Vision.
Freddie Portman for District 8.
Carolina F. Center, Operating Office. Necesidad Free Center, Catara Statue.
That's right, I'm playing with Grace River.
Elizabeth Alonso Villarreal, Bless Laredo wins against drunk driving.
I'm at Spring, Texas, Rusty Gold.
Roberto Sánchez, West Care, Prosperemos Studios.
And we have Ms. Angie out in the back. Thank you everybody for being here and welcome to our Laredo Webb County Drug and Alcohol Commission meeting. At this time, I'd like to ask Pastor Reyes to give the invocation.
Yes, of course. I want to thank everybody that takes time to come and join us in the meetings and all the hard work that you all do with the efforts. You know, we see the results, we have the fire department, and we saw the numbers, you know, they've been going down because of the Narcan, and it's because of all the effort that, you know, you all do to come and to do this, and, you know, that's just exactly what we need to do, help each other. So I want to bless you, and if we could bow our heads to our Heavenly Father, we give you thanks for this beautiful day, Father, that you've given us, and for allowing us to come together as a community. Give us the wisdom, Father God. Your word says, Father, we need wisdom that we ask the Father, and He would give us in abundance, so we could help our community, Father, and work together in unity as you ask us for. We put this meeting in your hands, Father, in Jesus' name, amen. Amen.
Thank you so much for that. Ms. Angie, do we have anybody for public comments?
No comment.
Thank you. At this time, I'd like to request an approval of minutes for April 10, 2024. The minutes are on the left side of the red folders for the commission members. So if I can have a first and a second, please.
I'll first.
I have a first by Hidalgo, and I have a second by Ms. Alonso. All in favor?
Aye.
Motion passes. Moving on to administrator's report, Dr. Chamberlain, would you please give us a report?
Absolutely. Good morning, everyone, and thank you very much for being here with us today. I wanted to provide a status update. The last time we had shared this presentation, there was a nomination for the Texas Municipal League Partnership Award, and it was an award that was presented to us on the Monday night at City Council by the Texas Municipal League. But I wanted to make sure that we could share it with the Drug and Alcohol Committee for the work that has been invested into our overdose, our response for the last, how long has this committee been meeting? More than a decade.
Originally, the original was 2013, and this one was maybe about 2017, maybe 2017. Yeah, but the original,
A decade. So it's for decades of work, and to be recognized is a triumph for everybody here. So I want to give each and every one of you a round of applause for being part of that. I'm also sharing that next week, fire, police, and public health are traveling to the Overdose Response Strategy National Conference in Dallas, Texas. We were invited by the High Intensity Drug Trafficking Area, the HIDA, to collaborate with DEA to share about the response strategies that we've employed here in Laredo Public Health, putting us on a national platform. So I wanted to make sure to let you all know that we are going to also spotlight the work that we've done with the Drug and Alcohol Committee while we're there at this conference. That's a panel that we'll be sitting on. And I don't know if there's a virtual realm, but if there's a virtual realm of this conference, I would implore you to take part of it. And definitely sit in and watch in support of the panel that we will be participating on.
What day will that be, Doctor?
It's the 14th, 15th, and 16th. Our discussion is on the 15th at 2:00 in the afternoon. I did want to provide a couple of updates on the next steps that we had shared when we presented this presentation. I think we presented this presentation the meeting before last, if I'm not mistaken. And so we connected with the Foundation for a Drug-Free World. They have a plethora of resources. Most importantly, they have them in Spanish at vida.org, vidasindrogas.org. It is an amazing resource, and we're collaborating with them. Jaime, you want to share a little bit more about that?
Yeah, so we met with them a couple weeks back and we're pretty much collaborating. We're gonna partner with them officially, so we're putting together a press release with them. They're gonna help us, like Dr. Chamberlain said, they're gonna put a education program for our children and young adults. So we're gonna try to target kids in elementary schools, teach them the facts about drugs. I know it's a tough conversation like they mentioned, but I think it's something that we need to do as a community. So we won't stigmatize, oh, drugs are bad, starting from the roots. And then we're also gonna be working on a PSA with them, also targeting children and young adults. And that should be coming forward by the end of this month.
They have many different videos of a person, using cocaine or ecstasy or salvia, all these different videos that are in English and in Spanish, and it's targeting the younger demographic, representing these people and exactly what they're doing, how it affects them and those persons around them. I think they're very powerful videos, and we look forward to also collaborating with our local media agencies to push those out during primetime television so that those persons feel it and those families see it as well and step in to ensure that there's those overdose and substance use interventions facilitated. We also pushed out the Never Use Alone news release, and I will ask Ms. Adriana to share a little bit more about the Never Use Alone.
Thank you. As a harm reduction campaign, the Never Use Alone, it's a number that the client or the person calls to not use alone. So whatever substance or they were planning on using, for them not to be alone. So they have a plan in motion, so whatever you call, you get this assistance. The Public Health Department is launching the campaign of Never Use Alone to teach the community and make awareness on this resource. So the crime promotion specialists, plus the new release, we're sharing this information with the community wherever we go.
Thank you for that. And while we don't condone the use of illegal drugs or abuse of prescription medications, we believe that harm reduction strategies in general are important to saving lives. We also have been collaborating with the National Harm Reduction Technical Assistance Center. I know we did share at the last meeting, I unfortunately wasn't able to be here, my apologies, about the outreach safety for harm reduction, reductionists that will be happening, the training that will be happening on May 15th. Ms. Adriana, you want to share a little bit more about that?
So I want to thank everybody for your participation. Actually, we have 30 spaces available and we have 32 people that registered for this training. So this will be next Wednesday around this time from 10 to 12. And it will be to talk about how to be safe around conducting harm reduction strategies and going out in the community. This, yes, of course, is with the assistance of the National Harm Reduction Assistance Center. So the presenter, the webinar should be here on camera, but everybody else will be around this table getting the training. Then on May 15, we'll also have the principles of harm reduction, which what we're trying to do is have one training per month. And because it got for the outreach safety for harm reduction, we're thinking of bringing it back for July. So in July will be another opportunity for those that weren't able to participate or register for the harm reduction on this month. Know that we will have it again. And the principles of harm reduction will be next month. So this campaign is about harm reduction and bringing into the community that knowledge.
Thank you, Your Honor. I'm going to go on to the harm reduction program at Laredo Public Health. On the next council meeting, which is May 20th, we will have the creation of the harm reduction specialist job role here at Laredo Public Health, which is something that is necessary within the public health infrastructure system that will be collaborating with all the different agencies and entities here in the community and championing this specific cause. I know that our fire department has been doing great work with the T-Tour and their ARPA funds, but those programs will come to an end, and we're very hopeful that we find other award opportunities to keep them going. But this specific role will be part of our foundational programs and programs and services as the structure of Laredo Public Health going forward into the future. We're excited that this is going to be part of the public health workforce So as soon as this opportunity is posted, of course, we're gonna share it with persons in the community who would be interested in coming on and taking on this role. There is a lot to do within harm reduction. Of course, it's not just specific to opioid, as we all know, harm reduction is on the mental health side, is on alcohol, it's on all substances. And even fall prevention, right? I mean, that's a part of harm reduction. So this person will be bringing that into, or that expertise into the Laredo Public Health infrastructure, but ultimately serving the community with this new program that Laredo Public Health will employ. We're waiting on response from our community mental health grant to be able to expand the lay counselor network. We're hopeful that we get response back in August, letting us know that our budget has been approved, and that way we will be able to expand the lay counselors into our public library systems. Of course, they're not for treatment, they're more for single service interventions and just allowing persons to know that they can come in to those quiet, safe spaces and know that there's somebody that they can speak to, that then can take their situation and get them to the necessary help that they may need. If they're not able to resolve, some type of conflict that might be, with a financial situation, I know where I can get you to support for that, whatever it may be. We're very excited to expand on the lay counselor network. Since I'm not very familiar, there's other organizations in town that do lay counseling. Do we know?
There's peer-to-peer, but Dr. Chamberlain, I was really intrigued with your discussion last week at Mental Health Symposium about the lay counselors at the libraries. And I think that's an excellent idea, and I don't know if these are gonna be, they're gonna be volunteer positions, is that correct?
We're not going to volunteer our library staff to.
No, not the voluntary staff. And just, I was just thinking, when you mentioned it, I thought maybe a good way and a way that you can get the team of mental health lay counselors is to partner with the TAMU graduate students. Because they're already going through some type of training, they're willing. And, even though, it can't count for practicum or internship, that would be a place to start, I just wanted to give that suggestion. I didn't get a chance to talk to you last week.
And it's our goal to increase the number of lay counselors, no matter what, for residency building in the future.
I think it's a great idea.
So we're gonna offer it to our library staff in the library,
Right.
because we would like them to be there throughout office hours of the public library.
Right.
And then we wanna build it into the community as well by offering this training. Of course, we've looked into these programs that are certified, or not certified, but that the guidelines that come from SAMHSA
Yes.
on how to certify these individuals. And these programs run anywhere between $5,000 to $9,000 to get this done. So we're investing into the first 9, and in our next go around with the community mental health grant, we wanted an additional 9. So we want to keep on compounding on the number of individuals who have this additional level of knowledge and credentialing, of course, not on the treatment side, but those single service interventions, that one time that you can connect with somebody, as studies have shown, can have a profound impact on that individual. And then also first get them to the support that they may need if there is a little bit more underlying, if there's that darkness that they're feeling for a little bit of time.
It's a great idea, Leslie.
Thank you. It came on the treadmill.
Good trip.
And then, of course, in the past, we did discuss I'm sorry, I'm taking up too much time, in the past, we did talk about the overdose prevention think tank, and I know that Jesse had mentioned in the past that it'd be more powerful to have a workshop out of it, not just an hour, because that really doesn't allow us to really delve in and to unwind and to really ideate what we need to do. So I was thinking if we can put it on to, of course, this is at the request of you all, put it onto the next agenda for June so we can talk about how we can strategize as a group to make that happen at least from 9 to 2 p.m., not the whole day either, but just a good amount of hours, at least 6, so we can structure that a little bit more and to keep that momentum going as we had one last year. I think it would be better to come back into this year and develop it a little bit further by having that workshop set up to bring in our ideas and to have I know we have a plan of action, but maybe have it formalized, like on paper, a structure that we can also demonstrate to the members of our community what we're working on, and ultimately just try to do the good work that we're doing on a daily basis. So if that's okay, I'm just putting that out there for the members to be able to request that to be on the next agenda. We are having a second round of knock and talk, not specific to substance use disorder, but for mental health. And so we're gonna be going to every district. It is the last 2 weeks of May. Yeah, the last 2 weeks of May, so each Monday through Friday, we're gonna be in District 1, District 2, District 3, knocking on doors, making sure that people know about 988. It's important for the members of the community who don't watch the news, who don't get news releases, who don't follow social media, to reach them. We had such a success with the knock and talk to distribute naloxone and to increase the awareness of the resources that are available for substance use disorder in the community, that we know that, of course, the grassroots campaign are very powerful. So we'll be out there, again, doing a knock and talk for mental health. But of course, substance use disorder is underneath the umbrella of mental health, so we'll still be pushing out information. And if any one of the organizations in this room wants to be part of that, we encourage you to connect with Ms. Adriana Morales, our public health promotion supervisor, who will facilitate, will include you into those walks. And of course, that's an opportunity for the group to get more information out about services that your organizations are offering, ensuring that we're maximizing and achieving higher levels of equity in the community. I wanted to share that we have purchased naloxone, and we will continue to purchase naloxone into the future with our general fund, which is a win. We're very excited about that. Also today, we've added another distribution site for naloxone in our community, so we have 8. With Roots Recovery as part of the system as well. It's the only 24/7 place where you can go get naloxone if needed. But now we have our mobile recharge unit, so it is the first mental health mobile unit in the city of Laredo that is going to decentralize access to mental health services with telepsychiatric services offered on the backside of the bus with a screen just like the one we're seeing on that side, and that person can connect in the moment in the neighborhoods or at special events as well. That recharge unit is for recovery, for rest, for resources. It'll also help support even our persons who are unhoused as of this moment or have been chronically unhoused as well, to recharge their cell phones, to give them a cup of coffee. We want to make sure that we are tackling as many social determinants of health with this mobile recharge unit in the community. So that ribbon cutting just happened this morning. So look for us out there in the community with our primary integrated healthcare unit, which we do have, and then now we are supplementing our mobile fleet with our mental health recharge unit as well. And we're still looking for additional state and federal funding. So if there's any additional awards for collaborative, because we are always collaborators and never competitors in public health, please look to us for that support. That's our report.
Thank you. Thank you so much. It's one of the great things. I wanted to make sure that I commend you, Dr. Huber, and your team for having to compile all of this great information and outreach and educational events for our community, because one of the most important things is to get it out to the general public. So I appreciate you for having to report on that. There was a date on there. I did want to consider coming into the harm reduction next week, but there's multiple things going on that day that I'm going to probably spread myself thinly. But the one for June 15th, it's a Sunday.
It's June 12th.
June 12th. I was going to say, is it going to be like the Wednesday or
Yeah,
whatever is on the Wednesday?
the Wednesday right after, you know how you have the one, Wednesday, the first Wednesday of the month? That those trainings are gonna be the second Wednesday.
So the potential for July is the second. Yeah, Wednesday after that. Okay, great. Thank you so much. We're gonna go ahead, if there's no discussion or questions for Dr. Chamberlain, we're gonna go ahead and move on with the detox facility update with Dr. Viviana Martinez.
Hello everyone, so, the status, we're partnering with, LC, the Health Career Institute, CAMU, UT, Public Health, and UT School of Social Work, and so, and that is for their students to come and do their practicums with us. That's already in motion. LC and Health Career Institute, and UT Public both Department of Public Health already have their MOUs with us, and we're finalizing the one with TAMU. I don't know if you guys are aware, but SAMHSA put out a communication that $1.6 billion were allocated specifically for opiate, treatment, prevention, and care. So I am on the lookout for our request to come out so that we apply for those that, federal funding that was now been allocated. In terms of the center itself, last month, Dr. Mateo Reyes, shared how he sort of staggered and started opening beds. As of this month, we are, opening the full 24 beds to the community. So we have had 56 admissions, to date. 8 of them are female, 47 are males. This data is as of yesterday, May 7. 166 referrals that have come in. Most of them are self-referred, although we have been working very closely with AMA, and so we have had quite a bit, AMA referrals and admissions in this past month. And we've been working very closely with Pastor Vegas, for support, for referrals, both ways. But also I do want to recognize Red Center for the support they're giving us with providing transportation to individuals that need to go to services to come in, and then also after they leave. So we're very happy with the support we're receiving and the collaboration with Red Center. So thank you very much, Pastor. And so to date, 70% of our admissions have been uninsured. They have no source of income or insurance, receiving their services completely at no cost to them. And 30% of them have had a form of insurance. Now, I do want to ensure that that insurance is government-funded insurance. So these individuals are still considered from low-income families. 90% of our admissions are dual diagnosis, so basically they're receiving both substance use and mental health services. Some of them are already coming with a known diagnosis, others are being diagnosed while at the center, and they're receiving care through Dr. Gloria Machaki Coroma. So we either reinitiate their psychotropic meds or initiate it with psychotropic meds while they're at the center. Our caseworkers and our counselors are working very hard to linking them to post-care, because we know that it's very dangerous to start them on psychotropic meds and then just drop them. That can do more harm than good. So they are being linked to our local agencies so that when they leave the center, they continue with their medication. They do leave with a prescription so that while they have, some of them are needing to wait 2-3 days to get into an appointment. Other border has been really good in saying they can come in as a walk-in, and that way we start them right away. So we've been successful with that. As Dr. Chamberlain shared, we are a 24-hour Narcan site. And I do briefly want to share one of the stories that we recently had. And so this is where, we're really paying attention as to the needs of our patients when they're coming in. We did have a young man. During the admission process, we identified that this individual, despite not voicing, had severe mental health issues and was suicidal, even though he wasn't voicing it. He came in letting us know that he came in with approximately about a dozen different prescriptions that he takes, but he shared that he took, before coming in, dijo, me tomé de todas y no sé cuántas de cada una. He had done fentanyl, heroin, and crack, and Xanax bars before coming in. So obviously, we expected that he wasn't, going to be all there, as they say. But first and foremost, we recognized that he was overdosing. But he kept on saying, he wasn't very verbal, but he kept on saying, ya estoy cansado de esta vida, ya estoy cansado de esta vida, ya no quiero seguir. For me, I took that as a cry for help and suicide, ideations and attempt. So we contacted the 911. He did make it to the hospital. He did refuse Narcan. Even though we knew he had other things in the system, we wanted to start him with something he wasn't allowing us to administer the Narcan. Luckily, when we do call 911, they show up within 3 minutes. So within 3 minutes, we had the ambulance there. He was taken to LMC. While at LMC, he broke his glasses and slashed his throat. So this individual, that got, came to us, we were able to recognize he needed help. And, from what I know, he's still in Harlingen at the psychiatric clinic over there, he hasn't been discharged. So we talk about fluid diagnosis, and we know that the majority, if not all of our patients, have a mental health problem, right? By their underlying issue for their substance use. But this individual, despite saying, no, I'm not trying to hurt myself, I'm not trying to die, it's just, we know his actions and his words, despite it not being directly saying, yes, I don't want to live, were telling us that he was at the end, of what he could take. And so he came into us, and even though we didn't admit it, we made sure that he went to where he needed to go. We have had about 5 or 6 individuals we can admit, and it's because this is not the right place for them, but they do need going to the appropriate level of care. So that's something that I want the committee to know, that we might not be able to admit them right at that moment, but we are making sure that they're linked up and somebody's taking them. We do our best to not allow them to leave on their own, and that there's somebody who's going to be able to help them, whether it's we initiate a crisis intervention for them, or we get a family member to come and take them directly to Border Region Heal or whatever it is they need to go. But in this case, this individual got hospitalized and ended up in a psychiatric. And they're aware, family know that when he gets discharged, if he still needs our help, he can come to us. So that's what I have for you all today.
Well, thank you very much. We really appreciate what you all are doing, and the story that you just mentioned is a lesson for all. A little lack of kindness, noticing things, makes a big difference. You save that man's life. On the collaborations that you do, I'm glad you're doing all that, but one of the things I thought of, it reminded me of back in the day, we had a collaboration with the and we would get their residents.
We're working on, yes.
Okay, because that was great when we had residents to do psychiatric services, so, congratulations. Good.
And we're hoping to expand those collaborations, so we're also fully have, we know that it's not, we always need help, we always need to add on more, so resources we can provide.
Well, congratulations on getting from 24, you've been pretty up.
Thank you so much. Is there any other discussion or comments for Dr. Martinez? Thank you so much for your report. Appreciate it. We're gonna go ahead and move on to discussion and possible action. I wanted to see what I could get some feedback and happy to set future objectives. I know that we talked in the past about doing a workshop, and Dr. Chamberlain brought it up in his report, and so I think that might be something to bring up at the next meeting or to agree upon it now. And then I wanted to see what you all want to continue to do or to set in mind and in motion, because I think a lot of the work, I think Dr. Chamberlain has been very attentive to listening to everything that we're talking and that we've discussed back and forth. So again, with his leadership and his team, I think they put a lot of this into action. So again, I want to say thank you for that, because there'll be opportunities to do the knock and talks with our agencies. And I think if we can go on out there, myself, Grace Center, to go out and to support you all, and volunteer, I think that would definitely be something that we can do. One of the other things I wanted to discuss is, again, getting information out and wanting to ensure that the Substance Use Services Directory is updated. It was last updated back in 2019. Mika had been tasked to update it, and I know that it's very essential for the community, and it's something that could be used at the detox facility and also here at Public Health to be able to know what services we have, so that we don't work against somebody else's service, that we'll work together. So if there are referrals, if there are availability to send and to help these individuals, and there is that resource directory. So I wanted to see if somebody would be interested in picking up that, or having to give us the idea of where to start. Additionally, the website, wanted to let the commission members that the website had been provided by the city of Laredo. We are on the website, but there has to be, so there's some things that we need to review and update, including the substance services directory. And again, if anybody is to Google right? Substance abuse or resources in our community, Laredo, Webb County. They're gonna go to our website and our website is not updated. So I also wanted to see if anyone would be interested in giving ideas or having to, see what we could do there. And then I wanted to bring up the public service announcement because the last public service announcement that the Drug and Alcohol Commission had done was way back when Dr. Alonso's, or Ms. Alonso's, story of her son. And we want to collaborate, especially during this time, and then for the future, kind of having to see if the Drug and Alcohol Commission can work on maybe, with the support of the city of Laredo, to work on these public service announcements and do them on a quarterly reminder and have it to be timeless, because proms in the area, graduation's coming up, then we have summer, and, you know, we have different things happening, and so, if we can get some collaboration from the commission members to see if we can put that into action and tag it as the Drug and Alcohol Commission, and that's something that we're doing. So I kind of wanted to bring that up, but I wanted to get y'all's feedback. How do y'all feel?
Is there someone that's taking care of the PSAs or not?
The PSAs, I'm gonna ask Dr. Chamberlain of the city of Laredo to see if they can go ahead and film it. The last time the city of Laredo filmed it for us. All we had to do was script it and storyboard it, and then we got stuff pretty much
Is it
done.
looks out like it's good for me just to see what you can.
The city of Laredo would want us to do that, or we would do it ourselves. It's just a matter of, here, it's just a matter of getting what we want to discuss, what PSA we want to put out there, and then getting it done. I think that that's the easiest thing.
Testimonies of different gentlemen that are in our facility. Ramiro Fernandez, he was overdosed, and he was in life support. 34% of it was just him, and we came back, thank God. And he's been he was in our program for a year, and now he's already like he's fast man. So, you know, we want the testimonies, not to talk about race in it, but, you know, just to give the awareness of what's going on and that they made it, you know, but if there's out there, you know, so we have to, like, different people that we can use, so if you need any assistance or help, you know, we're sure.
Thank you. We'll go ahead and put that as a note and see if we can reach out as a potential public service announcement and testimony, just to put that on our website, put it on our Facebook and share it and have people, get people hooked. Thank you.
I have some free airtime on the jumbo screens throughout town. So if you want to put testimony for the Drug and Alcohol Commission. So we'll take our location for one of them, and I don't know for how long, but I got free airtime.
Anytime is good time.
Thank you.
Thank you.
Thank you.
And mind you, the ideas will probably come from us, but the creative would definitely come in through the city of Laredo Public Health. And if we can collaborate or set up a meeting so that we can kind of discuss it and then put out something on behalf of the Drug and Alcohol Commission, please let me know with the availability of that. I have radio connections, and we can obviously, PSAs are free, so that's not a problem. It's just a matter of getting it through our networks and getting it out there and seeing how long the campaign is going to run and what that campaign does for our community. I know, being that May is Mental Health Awareness Month, I know that suicides have gone up, and that's the unfortunate, and that's something that we want to focus on. As Dr. Martinez mentioned, the underlying is mental health. So I know that you mentioned that potential overdose, and then I believe in the news there was this issue with the funeral collection, and then it had to do with somebody who may have overdosed. So the problem is out there. It's unfortunate. So the more that we continue to say it and bring to the community, I think we can make an impact. And it's something that's never going to go away, unfortunately. So I think all of our efforts are very important.
I think it's important to ask like PSAs of resources in the community, because we get many calls and they say, well, I don't know, you know, and I know the detox is new, but when we're talking with the families or the potential patients, they tell us, well, I'm not, you know, Scan's been here forever, you know, Border's been here forever, you know, Pillars, you know, has been here. So when we talk to them about what research, like, well, I can know that's what they did, I can know that's where they go. So I think it's important that for PSAs, we emphasize, right, the stories and all that, we'll get home, but the resources that are available, because we find many resources that say, I didn't know, I've been here all my life and I didn't know I had this resource in the community. And so with that, we also, I think that's something for them to on what resources are in the community and where they can reach out for help.
Can we do a website for the roots?
But there
So
is already,
it is?
there is, yeah. it's
Detox
with
South
Laredo.
Laredo or something?
It's with, so if you just put Laredo Detox, they'll pop out, or
Yeah.
because since we're with the city, we're under the city of Laredo. Also in the directory, there, the detoxification department shows up, so we click on it, and, it has, what it is about, how to get services, how to get it, everything is on there. And also the point of contact, it also has a contact me section. So, and we have gotten several, people that have gone through it, and that's where they reached out for help, and it gets to us. So there is already an active, up-to-date, just yesterday, the day before I went in there to add some information, new information that came to us, so it's up to date. So it's
I
been-
did it, I think you sent us an email.
Yes, yes, I had asked,
I looked at it.
so, yes, it's on there. It's
I think
already
we
on.
just need to broaden the, South Texas, because you put South Texas detox and we get
Yeah.
Starlight and we get all.
We'll find out, I'll work with Jaime to see how we can, how we can then, get it out there. I want to add now that we have Miss Jessica's, we got too much. We will work on having like a social media page, hashtags and all, because a lot of them rely on that. So we're gonna work, that's the next part. Our official pages up there, and then we're also gonna start on that. But I think having that resources out there so that we continue to emphasize what's out there, people don't know.
Dr. Martinez, is the website or is it in Spanish?
I think there is.
And, I mean, anybody who has their preferences set on their browser,
Yeah,
it'll
they
automatically
change it on the
translate the
browser.
language that's your
Yes,
origin of.
yes.
So if you're French, it'll translate to French. If
Yeah.
you're Spanish, it'll translate to
So if
Spanish.
you go in and you're sending sorry like that, it'll pop up. Yeah.
And sorry, go ahead.
No, go ahead.
If I may, I just wanted to say thank you so much for wanting to modernize the directory, the website, and public service announcements. But of course, I think it'd be great for us to have some type of action item from the directory right now. We can definitely take it on to build it for the group, but I think it would be really important for us not having to connect with every single person to ask for the contact, the services provided, the address. We can develop like a little survey and send it out to the group via Angie. So that way you can write your name, write your address, write your services provided, et cetera, whatever we need. So that way it automatically populates it for us into a form. And then we can just make it look really pretty and then be able to share that with the group as well, post it on the website, but then also have it for like the detox and other
And the
organizations. This is a resource sheet for what you can find in Laredo. So I think it's a brilliant idea. I'm pretty sure there's still some partners that are not here today and that are part of the email distribution list that we can get that out to. So I wanted to put that out right now as an action that we can start immediately. If that's okay with the group here, because ultimately, it's what comes from the committee.
Well, no, and it's actually, I love the fact that you want to take lead on it, so if you are willing to lead it and then we just fulfill it and then promote it, then.
Because that heavy work comes from the group, because it's just us cut, copy, and paste.
No, and I think that we can probably share, Ms. Alonso probably has, or Marina, even at that you all have other, services, and nonprofits that you all work with, that you all could probably share and say, make sure that you put your information on this link. And then that could be taken care of, and I think that would ease up on a lot of going back and forth. So do I have a motion to, move?
Yes.
Okay, I have a
Within
first.
that motion, can we get some more specifics, if I may ask, like, what does a form need to have? Like, contact name, name of organization, services provided. I would want to know what the group wants so that it's collected and that it's transparent. So it's not like, oh, you put this for them and you didn't put this for me. So it's just uniform and we're getting all.
So I think you nailed it, using the same, format that we have on the resource directory, which has the contact person, maybe not the contact person, but having that contact to be able to use for future. But the name of the organization, the services provided, location, address, website, and then the last resource directory did have services, fees to services, or what type of payment they'd accept, or if it was free or if it was like a
or how to quantify?
Yes.
Okay.
That's a good way to start. To say, you all have done that before.
Yeah, I was just gonna say, can we just send you the brochure, the pamphlet of all our services? Because we have so many programs that I don't think I'm gonna be able to.
Well, but
Give you
that
a-
would be.
So I can just give you the
They
brochure.
would just click on your information, so they don't have to type the whole thing. You just go to that and.
The links you provide could also link directly to your brochure.
Yeah, I was just saying that the scan record that they put out might be a good place to start. The service is good.
And I don't know if they still do that. Do you all still do the directory, the community directory?
Community directory.
Well, maybe you have to reformulate that template and that link where they could put that information. We can send out to those individuals that are on that resource directory and see if they want to be part of the directory that's going to be on our website.
Yeah.
So if that's good, then we have a first by Jesse. Do I have a second? Okay, a second by Mr. Diaz. All in favor? Any opposed? Motion passes. Thank you.
Just one more thought, Mr. Taylor. On people going out and making presentations, I think it's important that they mention Desert Catholic Grace Church, because the 4 pillars of healthy recovery, mental health, and substance use, physical, emotional, mental, and spirituality. If you don't have spirituality, faith, that's what boys do. So I think it's an important, when you have the people out there making presentations, would it be okay to do it? And by the way, I heard a lot of great things about you at the mental health symposium. What you all are doing, a lot of mental health professionals told me.
Thank you.
All right, with the website review and the update, is that something that we just send over to you guys, Dr. Chamberlain, and then you'll update as you feel? I know he stepped out.
Yes. Yes, I mean, that's something that.
I was gonna ask you. Okay, he stepped out.
We'll definitely take that on.
Okay, and then with public service announcements, if we all come up with some ideas, we'll just share with him and then he can go
We'll
ahead.
run with it, we'll get PAC, we'll get TIO, yeah, we'll
Okay.
get done.
So, do I have any volunteers to review the website and update it as needed and then share that with the city of Laredo? And then I would like to see if I could get, some other ideas other than Mr. Diaz's, ideas. Do you want to see if you can share anyone? Earl? Okay, so we'll bring it up and then hopefully bring some ideas up to the table so that we can go ahead and put these into action, because I don't want to, leave all the work to public health and Dr. Chamberlain to get this done, because I think one of the biggest efforts is to not just say what we want to do and not do it, but actually get it done. And I want to emphasize on that, because I want to say that he has been paying attention to all the stuff that we've been asking and they've been putting it into action. So without further ado, if there isn't any more discussion to these topics, I do encourage you all that if you all want to bring up something on the agenda, to please let us know after the meeting so that we can go ahead and share it and put it into action. We're going to go ahead and continue with the stakeholder agency updates and presentation. Before our presentation, I wanted to get some of our stakeholders here present, the opportunity to talk about what may be going on with your agency or your nonprofit, and if you want to share, this is the time to share. So, Maria, do you have anything to share?
Thank you. Last week we gave, we were able to, Mike's Purpose was able to give their first 2 scholarships to 2 Nixon students, $500 each. So.
Okay. Jesse, do you want to share anything?
I'm practicing.
Okay.
We're doing, thank you very much.
Alrighty.
I want to thank everybody, just thinking about all what you do, I think it's important, I'm looking forward to behind it, seeing what everybody's doing, so, I mean.
Alrighty. Do you have any other stakeholders in the room?
Just want to mention that, I mean, I know you all are familiar with SCAN. Just want to put it out there that you all know that we have, an array of programs and services from prevention, intervention, treatment, mental health also. And also, I'm very happy to hear that the program is up and running. Every time I come to these meetings, it takes me back to the time when I was in that area. And when the Jornal had a actual residential but only focusing on the juveniles that are upward of juvenile. It was called Drug Free 2000 back then. So I'm very happy to hear that that one's up and running, and hopefully, you know, because the kids need a lot of help. And now with that fentanyl and everything coming up, you know, I'm praying for you all that, you know, that everything goes good and that all the kids are safe and healthy. And very proud of the city too, we're having this program.
Thank you for that. Any other stakeholders that would like to share?
Yes, so Loretta's Against Drunk Driving is thinking of doing PSAs on TV. I know that TxDOT has some, you know, some good stories of actual offenders whose lives have changed, you know, what it impacted. So we're gonna be doing that, and I know I haven't been here present a lot because of work, but maybe, and I know maybe in the future, in this drug issue is, I mean, it's basically a pandemic, right? We need to continue working together, and you all are doing an awesome job on that, but it's Drug and Alcohol Commission, so I'd really like to see maybe us tackling, especially during the prom seasons and all that, because it starts with alcohol many times. So maybe we can start the discussion on something to do with alcohol, you know, in the future, and I'll be more than happy. I'm making every effort to try to keep my calendar, you know, to where I don't have to travel. So, but that's what we're working on.
Thank you so much, and I think that that's a good point, because we are the Drug and Alcohol Commission. The fortunate is that we have a lot of individuals that are focusing on drugs.
And we need to continue. Yes, I'm
but-
not saying no, but,
But then you do make a point with having to say that it starts potentially with alcohol. You, of all people, have the information and the resources, so I hope that you make it to the next meeting and share that collaboration with TxDOT, and then hopefully maybe having to emphasize that or help promote it in one way, shape, or form. So I appreciate that, and I'm really glad to see you here today. Do we have any other stakeholders?
From our church that we pastor at Revive Church, we moved to a party place, which is a bigger location. We rented to a problem that we got into when we had 100 seats. So people weren't able to be sitting down, so we're looking for a place. And we found one, and we have the access to the parking lot. It's off of Delmar on Depot Middle.
17.
And we're organizing something we're gonna call Festival de la Salud, to really get the city of Laredo and different agencies like to do COVID shots, like HIV tests, you know, maybe have the donating blood, and have the mobiles. And we want to, the idea is to have like the Prosperemos Juntos and the different agencies, Speller, Max Purpose, also to use that as an awareness where we could bring people there, and we would have like bouncy houses for kids, just to attract people. It's not gonna be like a service or preaching or nothing. It all has to do with just helping the people, you know, with their health, you know, and not specifically drug or alcohol, but I've been working in this ministry, you know, going 4 years, and something that I've realized, you know, this is my opinion, you know, like in maybe, like I'm sorry, like 98% of the people in the radio know or have a family member that is in alcohol or drugs, you know, so even if we bring, you know, somebody that wants to know they're diabetic or they have high blood pressure, you know, we're also gonna be here giving back that everybody has stuff to get out from the different agencies. So we're looking into next month on the 15th, and the last Saturday, we still haven't set up a specific time, but I just wanted to let you know, in case you all are interested, you know, if you could just reach out either to Missy or me, just to say, you know, I want to be part, and that we already have your information, and, you know, we'll be able to, you know, there's just booths of 10 by 10. Those what everybody has their tents and put their tents, and maybe if they have something for mental health and they have like some fun stuff that kids can do or stuff, have that, and that way we could go to the news, you know, maybe they could interview us like maybe twice before the event, just remembering people, reminding people that we're gonna have that, you know, that it's not just one specific program or organization with the whole city coming together. You know, the detox center, you know, they could be there and, you know, people are gonna just ask like, what is it? Well, it's a detox center, you know, because there's people that hear detox and they don't know, probably think, you know, something about diet or something, because they're not educated in knowing that, hey, well, I have a friend that can work. And that's why I think if we could do that and engage with the people, we were gonna have like more results. So, I just wanted to mention that.
Once you have the information or the confirmed date and time, please send it forward to Ms. Angie, and she'll be happy to share it with all of us. But I think probably there's, some organizations that would probably be interested in.
Thank you. Appreciate it.
Any other, updates from stakeholders? Alrighty, so if there aren't any other, updates, then we're gonna go ahead and proceed with our presentation with Mr. Jaime Arista with West Care and DFC Veterans Ojos.
I appreciate it. So thank you all for the invitation. We really appreciate the invite, being that, this is a great organization. We're glad to be invited. I brought with me the project coordinator for the Los Peramos Monthly program under the DFC FACE. So DFC FACE for y'all, for some of y'all who might not know how it started. Actually, it was FACE Coalition, which was Family Assistance and Community Empowerment Coalition. It was formed by, Judge Hale and Victor Oliveros. And then I became a member. Back then it was with Stacata. And the arrangements were to be meeting with coalition members, perspectives, and we would talk about different issues in the community, bringing awareness about drugs and alcohol, targeting adults. So the DFC part is drug-free communities, and that part was initiated by West Care with a grant. Initially was for 5 years, and we were just awarded another 5 years. But what I'm gonna be speaking about today is that we now were awarded another grant, which is with Methodist Healthcare Ministries, and that's called Los Peramos Juntos Thriving Together. And our focus on this initiative was to provide the youth, and not only the youth, but also the families in our community with meeting the basic needs for health and safety. And that major focus was to target the populations, not only on the existing area that we have right now, which is 78046 with the DFC, but also going to the downtown community, which is 7840. And the hub of that facility of the center will be their holding institute. So that we hired 2 peer specialists aside from Mr. Sanchez, and the objective is to have them there at that facility to do outreach of prevention and intervention, targeting drugs and alcohol. So downtown, as you all know, it's a dying part of the city, unfortunately. It's a food desert after the HEB closed down. And so the nearest health clinic is 4.0 miles from there. And also there's other challenges that we're faced with, which is hunger and everything else. So fortunately, we do have the Laredo Health Department mobile unit who has gone there, and also Gateway Community Health Center has gone into the holding institute to host medical interventions. So in order to formulate this Los Peramos Juntos, we need to have 3 partners. So the partners are right now Pillar, which is with Mr. Sanchez, and that is going to be on a referral basis with the peer specialist and also with our partners. The Grace Center is one of our partners, and the other one is Community Schools, and then of course the Holding Institute. And West Care is the lead on this initiative. So the other other partner that just recently joined us is Communities in Schools. So Communities in Schools in the downtown area has the Jose A. Valdez School, which is a alternative school. And so we're working with them. They're gonna be hiring a coordinator / site specialist with CIS to provide awareness through faith-based and also through a curriculum we have with this Bachman Life Skills, which is evidence-based, to provide more self-paced curriculum for life skills for the children that are, the youth that are actually so let's we'll say about this targets community high schools students that are ready to graduate and want to go into careers. So we're working with them. There's in order to do the proposal, we had to have some objectives and goals, and of course, one of those was to provide the youth with outreaching to help them to obtain better overall health and obtain overbearing substance influence of drugs and alcohol. We have 3 large cartels that are targeting our border. And those 3 cartels, we always hear about them having warfares across our city, across our border. Unfortunately, they haven't ever come to this side of the border, and there are wars over here. We have had incidences of people that are involved with those cartels being killed by groups, but not where we have had actual wars between 2 cartels, major cartels, and their law enforcement to keep the drugs and their groups being formed. So that being said, it's a big challenge, because if you imagine you have 3 major cartels, they're all fighting for the turf, and they're using, what do you think they're using to bring the drugs over here? What do you think they're using? They use. Why? Because they know that if they have their youth involved in doing that the youth will probably end in the detention center. They're not gonna be going to jail unless they do a real bad, serious injury to someone, or they kill someone, or they kill some other people. But they only end up at the youth facility on Highway 59. So that being said, what does that have? What happens there when they're in that captive setting? They're gonna recruit other guys, another young people, to do what they're doing, which is getting out the drugs to the community, to the youth. So what we're doing, it's a small thing. You know, you might think, well, gosh, what are you gonna do? You're gonna change everything just because you're gonna do prevention and talks and little modules of life skills? You know, we have to be realistic. We don't think we're gonna do all that. We don't claim to do all that. What we're claiming to do is we're going to, on a one-to-one with your specialist, the area downtown area, we're gonna set up workshops with the family units there in the downtown area. Pastor Mike is considering opening up the facility to after school for snacks as the kids go from the Laredo Independent School District downtown area. Most of them are from Mexico, and as they travel towards the bridge, they always stop at the holding, ask if there's food. So Mike is going to open up that facility for after-school snacks. And while they're there, our 2 peer specialists that are stationed there will have an opportunity to do a one-on-one talk about safety, about, are you involved in drugs? Can we help you? If we have a real big problem, then we're gonna bring in, then do a referral to Pillar. I'm gonna let Mr. Sanchez go and continue with the next part of the presentation.
Well, first of all, thank you so much. I appreciate it. The work that all of you are doing makes a difference. It's sad to see and turn on the TV and hear the news that there's another case of overdose or death of overdose or mental health. And I haven't I meant to talk to Dr. Chamberlain about this, because I'm not too sure exactly how many of those overdose cases are related to mental health, which I think a lot of them are, in my opinion. Of course, there's other people here, they will have more experts in that area. But these are some of the stats. I can go through the stats, but what I wanted to bring to you is that we as a coalition, we understand that there's a big problem in our community. And that's what we're trying to do. We're trying, each one of us is trying to see how we can impact our community and bring awareness, not only to the kids, but to the parents. Our main objective is to start, hopefully at the younger level, in order for us to do prevention services, bring it in through a life skills curriculum that we have, in conjunction to doing outreach ourselves, But it's interesting because before I came here to this grant, there's another one that's also being spearheaded by Westcare, and they did the life skills curriculum in one of the schools, and we had about 100+ kids that went through the life skills. And it's interesting because we did have a pre and a post test, and just looking at the results here in reference to drug awareness and substance abuse awareness, when we did a field test for the kids, 66% had some knowledge in reference to substance abuse. By the end of the curriculum, we increased that to 78%. So that was a rate increase of 18% positive outcomes in reference to the knowledge. Anti-drug attitudes, it went from 80% to 91%, which we increased the level of knowledge for those kids in order for them to do, I guess, better choices. Anti-smoking, anti-drinking, anti-smoking 58% increased to 72%, and anti-drinking attitudes from 59 to 70%. So that's what we're trying to do. We're trying to increase awareness at a lower level in order for us to to prevent that problem at the end, when it's already at that level where it's being handled by the hospital or the groups or any other agency that is already at the medical level where you have to administer medication or go through psychiatric help. These are some of the schools that we did the botany curriculum through. Prosperemos Juntos, we are targeting the 78046 area, 78040 area, which includes Martin, Christian, Valdez, and then 78046 includes the UISD schools, which is LBJ, United South, and there's Step Academy, as well. So we are going to be working also with the LCDC counselors in the schools in order for us to look at the kids that are in higher risk population, in order for us to bring this life skills curriculum in conjunction with partnering with all of you and bringing these services to the kids. I think it's an excellent idea about the directory. Last in our FACE Coalition meeting, we had a presenter come in from 211 services, and I did not know about the 211 services because I come from the perspective of post-secondary education. Just recently, I came into substance abuse prevention and awareness, but the past 30 years of my life I've been doing post-secondary early education, and it's alarming. It's alarming to hear every day that there's another death. It's alarming to see and hear that last year the deaths from last year increased, or the previous year increased to last year's, and it keeps on increasing. And believe it or not, each one of is making a difference. And we hope to also play the small part in making a difference in our community. I had an opportunity to meet with one of the members that Casa Rescate, they went to Casa Rescate and they exited the program, and the life of that young man changed completely. From being down there at the worst lower level to where it is right now, it is making a difference, and you are making a difference. Not only the Rescate, I think it was also service to Pillar and also to Westgate as well. And I'm pretty sure he probably got some additional services through some of the programs. So that's where we are. We are a nonprofit organization that is a national program. Here in Laredo, we're located in Loma del Sur. I think it's 2100, right?
Yeah, that's our office.
2110 Loma del Sur. And of course, we have a satellite office in Hollywood Institute. So those are our email addresses. Right now, I don't have a phone because they're about to give us that phone in order for us to have that contact information. But you're welcome to send me an email if you have any questions. And I'm also happy to hear that the City of Laredo and the coalition here is doing the work of bringing all the resources together, because we don't want to be fragmented. We want to make sure that we know who our partners are, our collaborators are, and thank you for that. I know that even before I knew Jesse and what the work he's done, and I did not fully understand exactly when I was doing post-secondary education what his role was and how he was working with some of his clients. And it could be overwhelming. It could be overwhelming because sometimes it requires multiple services, not only one, but a referral to another agency in order for us to be able to be effective. And sometimes that's what we're looking for. If we're not able to help, we're able to have that resource in order for us to go ahead and refer out and provide that help for that kid. Because like you said, Doctor, we don't want to leave that client or that person just hanging, knowing that person may be in danger. So that's who we are. We thank you for the opportunity to present, and we hope to continue our collaboration.
Thank you so much.
Thank you. Hand it over. I think you guys are a little modest. Westcare is the largest nonprofit in the United States. Just to make it clear.
Yes, they are. And, interestingly enough, when we first started talking about the deep stop facility,
It was a Westcare, yeah.
it was with Westcare.
Yeah, back in 2013.
Way back, and Judge,
The jail,
everybody came to the table.
exactly. Maurice was here, Maurice from Westcare.
Yeah. So it was a long.
Yeah, I have one again.
You were there, probably. So when it finally came to fruition, I did contact
Maurice?
Maurice.
That's what happened.
Yeah, I did contact Maurice. Hey, guess what? Remember that seat? It's finally grown.
It's all about the seeds.
Yes.
Thank you so much for, I don't want to cut anybody off, but we know we have to go back to work. It's 12:47. Again, Pastor Escobar, you are here to present this information. One of the questions is, what were you awarded with Los Veremos Juntos? How much funding? 3.8 million was funded for 3 years. So again, they are seeking support from the resources here. We want to continue to invite you to be a part of this, so you could provide information and updates as to what you're all doing. I think it's a matter of, again, sharing and letting people know that what we're doing. So, is there any questions before we adjourn the meeting? Okay, really quickly want to say thank you to Freddie. Freddie left, but he provided the food for us today. Next meeting, we have Carolina providing the food. And then we do have a couple of vacancies and some potential to volunteer to bring in food for our meeting. So if you would like to consider, please sign up.
And for one of those.
August 14th,
September.
What is it?
September 7th.
Yeah, for September. I have September.
That's my statement.
Okay, so I will go ahead and ask for the meeting to be adjourned at 12:49. Do I have a first? Motion to adjourn. First by Mr. Alonso, do I have a second? I have a second by Marina. Thank you so much. The meeting is adjourned.